Welcome to Damal Consult Career Academy. In today's video, we're diving into the top caregiver interview questions and answers to help you succeed and land your dream job. Whether you're an experienced caregiver or new to the role, this video will give you practical answers, expert tips, and strategies to impress your interviewers. So, if you want to learn how to confidently pass your caregiver interview, you're in the right place. Let's get started. 1. Tell me about yourself and why you want to be a caregiver. Thank you for the question. My name is Thomas, and I have 3 years of experience in providing care and support to individuals in need. I am a compassionate, patient, and dedicated person with a strong passion for helping others live fulfilling and comfortable lives. I've always been drawn to roles that involve making a positive impact on people's well-being. In my previous experience as a personal support worker at ABC Care Home, I provided assistance with daily living activities, personal care, meal preparation, and emotional support. For example, I cared for an elderly client who needed help with mobility and companionship, ensuring they felt safe and valued every day. Seeing the difference I can make in someone's life, whether it's through small acts of kindness or ensuring their safety and comfort, brings me a deep sense of fulfillment. I want to be a caregiver because I genuinely enjoy helping individuals maintain their independence, dignity, and quality of life. I believe caregiving requires empathy, reliability, and good communication skills, all of which I bring to the role. I'm also committed to continuously improving my skills to provide the best care possible. 2. What qualities make you a good caregiver? I believe the qualities that make me a good caregiver include compassion, patience, and strong communication skills. Compassion allows me to understand and care for my clients' needs with empathy and kindness, ensuring they feel valued and respected. Patience is essential when working with individuals who may need extra time, support, or reassurance, especially in challenging situations. I also have excellent communication skills, which help me interact effectively with clients, their families, and healthcare teams. I ensure I listen carefully to their concerns, provide clear information, and build trust. Additionally, I am reliable and attentive, always focusing on the safety and well-being of those under my care. I take pride in being observant and proactive, which allows me to identify and respond to any changes in a client's condition. Finally, I bring a strong sense of dedication and flexibility to the role. I am committed to providing quality care and adapting to the unique needs of each client, ensuring they receive the support and assistance they deserve. These qualities, combined with my experience, make me confident in my ability to be a dependable and effective caregiver. 3. How do you handle challenging or difficult patients? In my experience, challenging or difficult patients often need understanding, patience, and reassurance. I always begin by actively listening to their concerns to understand what might be causing their behavior, whether it's pain, frustration, or emotional distress. I try to approach the situation calmly and with empathy, validating their feelings and providing comfort while maintaining clear communication. For instance, if a patient becomes agitated or uncooperative, I focus on building trust by speaking in a calm tone, offering choices where possible, and explaining my actions step by step. I've found that showing respect, giving them some control, and using techniques like redirection or de-escalation can help alleviate the tension. If the behavior persists or escalates, I would seek input from team members or supervisors and ensure we have a collaborative approach to meet the patient's needs safely and compassionately. Before we proceed further in this video, I want to share an exciting resource that will help you land your dream caregiver job. If you're preparing for an interview and want to stand out from the competition, our ebook, Top 50 Caregiver Interview Questions and Answers, is exactly what you need. This guide is filled with the most frequently asked questions and expert-crafted answers that hiring managers love. And that's not all bonus. You'll also receive professional tips on passing your interview with confidence and mastering the STAR approach to answering questions like a pro. To get your copy, click the sealer or fourth wall link in the description box below. It's super affordable, and we're currently offering an exclusive 50% discount for a limited time. Don't miss this opportunity to level up your interview preparation. For more details, chat with our customer care representative on WhatsApp or email us. Secure your copy today and take the next step toward a successful career as a caregiver. Now, let's dive back into the video. 4. Can you describe your experience with personal care tasks? I have extensive experience with personal care tasks, which include assisting individuals with daily activities such as bathing, grooming, dressing, toileting, and oral hygiene. I always approach these tasks with respect, dignity, and sensitivity to the individual's preferences and comfort. For example, in my previous role as a caregiver, helped clients maintain personal hygiene while ensuring they felt comfortable and empowered throughout the process. I understand the importance of maintaining trust and creating a safe, supportive environment. I'm also attentive to noticing changes in a client's condition, such as skin irritation or mobility issues, and communicate these observations to families or healthcare professionals promptly. My goal is always to ensure that clients feel cared for and maintain their dignity and independence as much as possible. 5. How do you handle stressful situations or emergencies? In stressful situations or emergencies, I prioritize staying calm and focused. I know that as a caregiver, my response can influence the outcome. So I try to assess the situation quickly and take the necessary steps to ensure the safety and well-being of the person I'm caring for. For example, if there is a medical emergency, such as a fall or difficulty breathing, I would immediately follow any established protocols, like calling for medical assistance, ensuring the individual is safe, and providing basic first aid if needed. At the same time, I try to reassure the individual and keep them as comfortable as possible while help is on the way. In non-medical stressful situations, such as emotional outbursts or resistance to care, I focus on staying patient and empathetic. I listen carefully, use a calming tone, and try to understand the underlying cause of their stress or frustration. My goal is to de-escalate the situation and address their needs effectively. Overall, my experience has taught me that staying composed and proactive helps resolve emergencies efficiently and builds trust with those I care for. 6. Why is empathy important in caregiving, and how do you demonstrate it? Empathy is crucial in caregiving because it allows caregivers to understand and connect with the emotional and physical needs of the individuals they care for. By putting oneself in the shoes of the person receiving care, a caregiver can provide support that is not only practical, but also compassionate and respectful. Empathy builds trust, fosters a sense of dignity, and improves the overall well-being of the patient, creating a more positive and comfortable environment. I demonstrate empathy by actively listening to the person I am caring for, acknowledging their feelings, and responding with kindness and patience. For example, if a patient feels frustrated or overwhelmed, I take the time to listen, reassure them, and adapt my approach to meet their emotional needs. I also pay close attention to nonverbal cues, such as body language and facial expressions, to ensure I am aware of any discomfort or concerns. My goal is always to make the individual feel heard, valued, and cared for. 7. How do you manage a patient who refuses care or assistance? When managing a patient who refuses care or assistance, I approach the situation with empathy, patience, and understanding. I begin by calmly trying to understand the reason behind their refusal, as it often stems from a loss of independence, fear, or discomfort. By listening actively and validating their concerns, I help the patient feel heard and respected. Building trust is essential, so I focus on creating a comfortable and supportive environment where they don't feel pressure. To encourage cooperation, I offer choices or alternatives that give them a sense of control, such as asking if they'd prefer assistance now or at a later time. I also gently explain the importance of the care and how it benefits their well-being, while being mindful not to push too hard. If needed, I allow the patient some time and space before revisiting the situation. In certain cases, I involve family members or other care team members to find the most effective approach. By maintaining patience, respect, and compassion, I can better navigate the situation and encourage the patient to accept the care they need. 8. What steps do you take to ensure the safety of your patients? Ensuring the safety of my patients is my top priority as a caregiver. I take the following steps to maintain a safe environment. 1. Conduct a safety assessment. I assess the home or care environment for potential hazards, such as tripping risks, inadequate lighting, or unsecured furniture, and address them promptly to prevent accidents. 2. Adhere to care plans and safety protocols. I strictly follow the care plan provided by the healthcare team, including medication schedules, mobility assistance guidelines, and dietary restrictions, to avoid errors or complications. 3. Safe mobility and transfers. I use proper techniques and tools like gait belts, wheelchairs, or walkers when assisting with movement or transfers, to prevent falls and injuries for both the patient and myself. 4. Monitor medications closely. I ensure medications are administered on time, in the correct dosage, and according to instructions, while also observing for any side effects or adverse reactions. 5. Maintain hygiene and infection control. I uphold high hygiene standards, such as frequent hand washing, disinfecting surfaces, and using personal protective equipment (PP) to reduce the risk of infections. 6. Communicate and observe. I maintain open communication with my patients and monitor their physical and emotional health closely. If I notice any changes in behavior, condition, or safety risks, I report them immediately to the appropriate professionals. 7. Stay alert and prepared. I remain vigilant at all times and stay prepared to respond to emergencies by knowing emergency procedures, maintaining emergency contacts, and being trained in CPR and first aid. By taking these steps, I strive to create a secure, comfortable, and supportive environment that prioritizes my patients' well-being. 9. How do you handle communication with the patients, family, or healthcare team? I believe clear, respectful, and timely communication is essential for providing the best care. When interacting with the patient's family, I ensure I listen actively to their concerns and provide updates on the patient's condition and progress, while always maintaining confidentiality and professionalism. I aim to build trust by being compassionate and transparent, helping them feel confident in the care I'm providing. When it comes to the healthcare team, I prioritize collaboration by sharing relevant information, following care plans, and reporting any changes in the patient's condition promptly. I understand that effective communication between caregivers, doctors, and other healthcare professionals is critical to ensuring the patient's safety, comfort, and overall well-being. I'm always open to feedback and willing to adapt as needed to meet the patient's needs. For example, in a previous role, I noticed a patient becoming unusually withdrawn and fatigued. I immediately communicated my observations to the nurse and healthcare team and updated the patient's family to keep them informed. This led to a prompt assessment, and we discovered an early sign of infection. By communicating quickly and effectively, we ensured the patient received timely care, and the family appreciated being kept in the loop during the process. 10. What is your approach to caring for patients with dementia or other memory issues? When caring for patients with dementia or other memory issues, my approach is centered around patience, empathy, and personalized care. Here's how I structure my care. 1. Building trust and a routine. I establish a consistent daily routine to help the patient feel secure and comfortable. Familiarity often reduces anxiety and confusion for individuals with dementia. I take time to build trust by engaging them with kindness, calm communication, and reassurance. 2. Effective communication. I use simple, clear, and slow communication while maintaining eye contact and a gentle tone. I listen actively and pay attention to nonverbal cues since their body language can express what they may struggle to verbalize. 3. Promoting independence. I encourage patients to do as much as they can on their own, providing gentle guidance only when needed. This helps maintain their dignity and sense of control. 4. Creating a safe environment. I ensure their surroundings are safe and free of hazards, while also making it familiar and calming. For example, labeling drawers or using memory aids like pictures can help with daily tasks. 5. Providing compassionate emotional support. I approach each interaction with empathy, understanding that dementia can be frustrating or frightening for the patient. I remain patient and never correct or argue when they are confused. I redirect attention gently when agitation arises and focus on soothing activities, like listening to music, looking at family photos, or engaging in light physical activities. 6. Engaging in meaningful activities. I tailor activities to their interests and abilities, whether it's light exercises, puzzles, art, or reminiscing about positive memories to stimulate cognitive function. 7. Collaborating with family and healthcare providers. I communicate regularly with family members and the care team to understand the patient's history, preferences, and changes in behavior. This helps provide more personalized and effective care. By combining empathy, structure, and flexibility, I ensure patients with dementia feel respected, understood, and cared for in a way that enhances their quality of life. Do you have any question for us? When asked, "Do you have any questions for us?" in a caregiver interview, it's an opportunity for you to show your interest in the position and the organization. Here are a few thoughtful questions you can ask. 1. What does a typical day look like for a caregiver in this position? 2. How do you support caregivers in their professional development? 3. What types of training and ongoing education do you provide to caregivers? 4. Can you describe the team dynamics? Will I be working independently or with other caregivers? 5. How do you ensure the well-being and safety of both caregivers and clients? 6. Are there opportunities for advancement or additional responsibilities within the company? 7. How do you handle scheduling and flexibility for caregivers? 8. What is the most important quality you look for in a caregiver? 9. How do you ensure clear communication between caregivers, families, and management? 10. Can you tell me more about the clients I would be working with? These questions can help you gain a better understanding of the role and how you might fit in. They also show your dedication to providing high-quality care. That's it for today's video on caregiver interview questions and answers. I hope these tips help you feel confident and well prepared for your interview. Remember, practice makes perfect, so rehearse these answers and tailor them to your own experiences. If you found this video helpful, don't forget to like, share, and subscribe to Damal Consult Career Academy for more career tips and interview preparation videos. Drop any questions in the comments and let us know what topic you'd like us to cover next. Best of luck with your interview, and well, see you in the next video.